Welcome to Readiness Recon channel. So today myself and my team are ready with a small discussion and I'm also excited that you are all having a prepared content relevant to today's topic, right? Yes. So today as this content is majorly can be used for all the BSc nursing first year students and it is only in the level of first year, so it's not more detailed. But anyway, this will aid in your examination purpose as well as when you are giving it. So before going into the topic, let me start with the case study scenario. So this case study is like when we all the students, when we all were posted in the clinical posting, we came across a patient named Mr. X. He was 40 years old and he was having a spinal head injury, who was brought to the emergency department with loss of consciousness, not responding to external stimuli, and upon observation, brain hemodynamics were totally altered. He was totally on an unconscious state, irresponsible, as well as not responsive to verbal, as well as motor or sensory stimuli. So, can you all guess the topic today? What we are going to discuss? The topic is care of unconscious patient. So yes, before going into the care of unconscious patient, here our batch are prepared on what are the possible or what is unconsciousness, what are the definition, what are the clinical manifestation the patient with unconscious will be, what are the common stages, and as a nurse, what are the nursing care we can give to this unconscious patient. So today starting on with the unconscious content. The introduction is that the patient is unaware to the might be to the sensory stimuli or motor stimuli, or there is no response to verbal stimuli as well. So with the definition, Ms. Aishwarya will be discussing on what she has prepared on the definition of unconsciousness.
Unconsciousness is a state of useless cellular function which causes impairment in response to sensory stimuli, loss of awareness to self, and surrounding certain amount of time.
Yes, what she told is that there is loss of awareness to the patient in herself as well as to the external stimuli. Next, what are you prepared, Jessica?
Causes:
Yeah, can you discuss the causes?
internal failure, head injury, subclavicular hemorrhage, cerebral infarction, intracranial tumor, CNS infection, constipation, external failure, metabolic causes, endocrine causes, respiratory insufficiency, decreased cardiac output, psychogenic causes, and abuse toxins.
Yeah. So the causes were simply they were divided into either due to the brain itself, that is cranial causes, intracranial, and if it is other than the cranial causes, might be endocrine factor, or might be it is due to other disorders such as hyperparathyroidism or hypoparathyroidism, or might be it is fluid or electrolyte imbalances, which are all coming under external cranial causes. Next, can you discuss about the stages?
Hello all. So there are 5 stages starting from confusion to coma. In confusion stage, the patient may feel drowsy, and second stage is delirium, where the patient can feel hallucinations and delusions. And the third one is obtundation. This is mostly seen in drug abuse cases. The patient may be less alert and also have hypersomnia. And the fourth stage is stupor, where the patient is not able to get aroused even after painful stimuli. And the last one is coma, where the patient is unable to respond.
Yeah, thank you, Pranil. So the last stage is coma, where motor response, verbal response, and eye response are totally of scoring 1 in the GCS scale. The patient is getting 3 out of 50. Next, we will be seeing about the clinical manifestation for the patient with coma. So here, patient will be having different symptoms such as starting from each lung organ wise. So starting with the cardiac system, the patient may have decreased cardiac output. So the common causes leading to decreased cardiac output would be arrhythmias or myocardial infarction, heart block, and so on. And in respiratory status, patient may have respiratory failure apnea, in some cases may have difficulty in breathing, where they can also have inbuilt cyanosis, either central or peripheral cyanosis. And in coming to the central nervous system, the patient is totally lack of the surrounding. So they will be having verbal response, motor response, as well as patient's eye opening are all not responding to the external stimuli even after giving a painful stimuli. So next we can see about the possible management. So when it comes to nurses, we nurses are giving nursing diagnosis. So can you discuss the first nursing diagnosis which you are prepared? Ms. Neetu? So yes, she is telling about the ineffective airway clearance. So in this, as the patient is totally on a lying position, unable to do the activity either externally as well as internally, which causes the respiratory compromise. So due to the respiratory compromise, the airway is totally either blocked or partially blocked. So this is mainly related to what? To the unconscious state and immobility, because patient is not moving in and around the bed or walking around. So totally still on the bed itself. So how it is evidenced? Might be drooling of the fluids from the mouth. So mostly frothy drooling of fluids from the mouth, which shows that the patient is having ineffective airway clearance. So what we can do, Neeta, regarding that, how we can improve the patient? Yeah, very good. So we can either put the patient in different positions. So might be most probably in these cases lateral position, because lateral means the patient is not going to have other complications such as aspiration behind the esophagus. That's the reason why she is saying that lateral position is most predominant. And of course, now we have also done is that always take a pillow. Do not have a pillow onto the patient in such cases if they are having the ineffective airway clearance. And you can always put the head towards the side in case if they are drooling of fluids. Next. So if the patient is being intubated with endotracheal tube, then you can immediately do the suctioning and remove all the separations. Yeah, then of course you have to know whether the lung is now clear or not. So for that you can just do the chest auscultation using the stethoscope. Yeah. So always maintain the patency of the ET tube, irrespective of the shifts. See that every second hour or every fourth hour or whenever the patient is having necessary of increased separation to do these separations. Postural drainage. So postural drainage is nothing but wherever the consolidation is found in the chest exit, you are going to put the patient onto the particular position. So mostly in anterior as well as apices, patient will be having either lateral position or supine position. In case if the patient's base of the nerve is being affected, then we have to do tendon elbow position. Yes, next. Yeah, very good, Sally. Patient is not able to do the daily activity such as bathing, brushing, going to the restroom, not having the perineal wash. Nothing is done by himself or herself because of unconscious state. So in those cases, the self-care is totally lacking. So we call it a self-care deficient. So why it has happened? Due to the unconscious state of immobility. And how you are identifying because of halitosis. Patient is having bad foul smell breath, as well as might be the skin is appearing very color changes there, some temperature is going down the skin, or might be skin exfoliation is seen on the patient. So what are the nursing intervention we can do for improving the self-care? What are the common care we can do, Sanya? Yes? Yeah. Yeah, very good. So oral care, eye care, pregnant care, skin care. Eye care, why we give is that after giving the eye care, we give some lubricating solutions onto the cornea, because when there is a blinking reflex, the cornea is not having any issue. If the blinking reflex is totally altered, in case of an unconscious patient, they may keep the eyes open, wide open, or totally tight. Both should not be happening. So frequently, each shift what we do is that we instill the corneal lubricating solutions into the cornea, and thereby we close it with the pad. Maybe sterile gauze pad with a small adhesive tape. This is to prevent the corneal ulceration. Mouth care to prevent the patient developing ventilator associated pneumonia because patient will be in endotracheal tube. Then of course perineal care to prevent urinary tract infection because unconscious patient will be having catheter. And then we are also going to turn the patient frequently, that is back carrier to the tube. The next intervention, giving proper grooming, maybe the external hands, cut shorting the nails and giving the appropriate dressing as per the hospital policy. So clean and tidy skin care can be given as per the hospital policy. Whatever powders or whatever gels you are going to use, whatever moisturizers you are going to use, the position chart to be maintained to prevent the skin exfoliation. So patient will also have impaired skin, that is skin integrity. Integrity is nothing but the skin pattern. This integrity is getting compromised because no proper care is given. So we have to do what is the frequently changing the position. Might be in some of the hospitals they will be having clock chart. So 4 o'clock means landing position, 8 o'clock means supine position. Then again after 4 hours, they will be frequently changing each position according to the mobility of the case. If it is contraindicated, then the position will be altering for each case. So that is how we will be giving the factor, as well as nutrition will be met, and we will be also using the Braden scale to prevent the pressure ulcer. Next nursing diagnosis will be
sensory or conductual alternation due to unconsciousness as evidenced by non-responsiveness to stimuli.
So patient is not having good response to external stimuli. Due to that, patient is developing impaired sensory and perceptual responses or activity. So how we can improvise this is that teaching the family members that though they are lying still, we may see that they are not having any activity, but still they are able to hear whatever we speak. So give all the positive reinforcement near the patient whenever we talk. And also teach the attenders that all the safety measures to be incorporated, such as not eating on all the eatables should not be put onto the patient's spot, because here the patient is not ever into a painful stimuli. So if an ant comes onto the bed, what happens? The patient gets bitten, and that may change into an anaphylactic reaction. So see that all the safety measures such as eatables and all other things should be avoided on the patient itself as well as the surroundings. And then padded side legs. Side legs must be padded because some patients may have seizures activity during the unconscious state. So you have a padded side legs by the side. Might be if necessary, you can lower the head end of the bed if there is a chance for aspiration. Or you can put the patient without the pillow on a left lateral position, heads towards the center. Yes, any other thing we have to discuss today? Yeah. So what are the things you are exposed to?
Hypoglycemia, multiple organ failure, fluid and electrolyte imbalance, pressure, so deep vein thrombosis, pulmonary embolism, and diabetes.
Yeah. So all these complications may arise for the case with unconsciousness. I hope you are all thorough of how to give a care to a patient with unconsciousness. Yes?
Yes, ma'am.
Okay. Can you wind up?
Yes, ma'am.
Okay. Thank you so much for your patience.